non-infectious diseases, as usual. Today's one topic which is very important for organization of high qualified outpatient care. This topic, application the principles of evidence-based medicine in the outpatient practice. I hope that you have already studied elements of this discipline, maybe on the Department of Clinical Pharmacology or Public Health Organization. But today I will specify the application of these principles in outpatient practice. Complex, is it moving presentation for you?
No, sir. It's still on the first one.
Then now, I hope you can see a second slide.
Now,
About
yes.
information. Am I right? And Information Society has set medical and practical practice problem. Which problems are? There are increased volume, progressive volume of medical information, especially for progressive growth of medical information about which disease do you know for last 2 years? Of course, about COVID-19. There are many new publications, and for usual doctor without any scientific skills or scientific and critical analysis of medical information, it's very difficult to recognize, to differentiate true recommendation from false or relatively true. Second problem is design knowledge-intensive medical technologies. Increased requirements of patients to healthcare system quality while maintaining the limited financial resources for health, even in economically developed countries. According to modern medical standards, we should organize obligatory testing of new methods of diagnostics, treatment, prevention, and of course, and also rehabilitation. Now is the most popular problem of effective rehabilitation of patients after COVID-19. So for these persons, we should also organize randomized controlled trials. As the most informative and as most high qualified medical scientific trials. Let's formulate the definition or main characteristics. Let's enumerate main characteristic of evidence-based medicine as separate discipline in medical practice. This discipline can help to develop a scientific basis for medical practice. This discipline can suggest any set of rules for clinical decision making. main postulate of evidence-based medicine is every clinical decision should be based on a strict, proven scientific facts. This proven scientific facts, with just these facts, we can apply for creation, for composition of modern clinical guidelines. Other definition, evidence-based medicine is it is an informative technology, presentation and use of medical information which allows the doctor to consciously and consistently apply only to those interventions in clinical practice, the usefulness of which there is strong evidence. It's a very deep idea which we should understand and apply day by day in our practice. Now let's enumerate basic principles of evidence-based medicine. In majority of clinical situations, we should understand it. Diagnosis, prognosis, and treatment of patients is uncertain, indefinite, and must be expressed in terms of probabilities. Probability of recovery, probability of risk hospitalization, probability of complications, and of course, unfavorable outcome of any progressive disease. Probability of an outcome for individual patient best assessed on the basis of previous experience of observing these or similar groups of patients, with same disease or same stage or same form of concrete chronic disease. In clinical observations, the bias and systematic errors. Any research, including clinical, influenced randomicity, are influenced by randomicity. Let's return to the usual clinical practice. Central place or central aspect of the interactions between doctor and patient, or base of this interaction, decision-making process. Each patient is evaluating the concrete and correct, of course, decision of his or her problem from doctor. It can be simple answer to the question concerning the health status of the patient. And maybe, of course, decision which doctor should perform on the level of entire clinical practice. strategical decision. According to this variability, we can detect, we can divide all field of medical practice on 2K levels for application of principles evidence-based medicine. The level of private, so-called private level of individual clinical case, and common general level of clinical strategy in relation to big or small groups of patients, clinically similar cases. Level of clinical strategy. Let's characterize both this level. Which decision doctor can make on different levels. On the level of clinical case, decision of medical diagnostics and preventive issues arising from the practitioner in their daily work to the heads of departments or clinics. So it's so-called a local level. For example, which decision about treatment of for example, elderly people with combination of some diseases, which most optimal treatment GP or district therapeutics should suggest for patients with, for example, combination arterial hypertension, diabetes mellitus, COPD, and osteoarthrosis. Which optimal treatment for avoiding of serious side effects of pharmacotherapy or medications, and for maximally possible prolongation of his life, and with maintenance of life quality too. It will level of clinical case, of course. As for level of clinical strategy, this level includes address issues arising from the heads of medical organization, institutions, and health administrative organs. And also this level covers efforts to establish clinical guidelines. Which we can and we have to apply in all organizations, for example, of any country, medical organization of any country. For example, very variable type of clinical guidelines now in Russia for last 2 years, already 14 versions of methodical recommendation, almost equivalent of clinical guideline, methodical recommendations for management of patients with COVID infection. Let's characterize more detailed main operations, which include process of evidence-based medicine. First step is the correct assessment of this situation. Which situation? What does mean situation? Situation, it's clinical case or Description. A description of any problem. For example, it can be pain, very common problem, pain in any regions. Pain, except pain, patient can express complaints on dyspnea, for example, for COVID-19 patients. Or any other problems such as cough. Next step of this process of evidence-based medicine application, principles application, is formulation of clinical formulation and detailization of any clinical problem for searching of new and necessary information from medical sources. Formulation of clinical problems, for example, problems of pain and cough, it should, detailization of this problem should include also clarification of type, this problem type. Is it a problem for require prevention, require definition of prognosis, prescription of treatment, and clarification of diagnosis. For example, which prognostic value of mixed dyspnea for patients with COVID-19, if this dyspnea more than 25 per minute. Or prognostic also value, for example, heart rate more than 100 beats per minute for patients with heart failure, for example. According to this clarification, we can compose the request or search strategy in databases. Databases we should use as most reliable source of regularly updated medical information. Which sources, maybe you know. Later I will specify these sources, but I think you have previous experience of searching of medical, scientific also information for decision of any tasks of your previous education. After formation of the search strategy, we should provide efficient search of the evidences, which will help to answer on this question or to help to decide this concrete clinical problem. After searching of any information or concrete results of clinical trials or meta-analysis conclusions, we should perform procedure of critical assessment of these searched information. Also, we have to analyze effectiveness of this information application or any technologies application. And also we should estimate, characterize clinical benefits, decrease the risk of hospitalization, for example, is clinical. Maybe economical benefits such as decreasing the cost of treatment. For concrete case or for concrete nosological form. After determination, after clarification of this benefit, we can apply, we can continue this study. Next step, it will application of the findings in concrete real daily medical practice. Of course, taking into account the patient's peculiar personal characteristics or peculiarities, or additional information about concrete patient, such as maybe genetic predispositions, such as unpleasant side effects after application of any drugs, previous anamnesis or accompanied diseases present now, and others. After application of this information concerning to our patient, we should evaluate the achieved results. Achieved results with analysis and decision making process about these results or recommendations for further application, this recommendation in practice. We should make a conclusion. Is concrete technology effective for example, for acceleration of recovery from COVID-19 or acceleration of rehabilitation, these patients' rehabilitation, or not so effective as we are waiting? Very important and key element of correct and effective information search process. Good result of this search. Main condition of this the correct formulation of the request or question for database. What does mean well-formulated question? This question clearly and in detail describes the analyzing problem. And this request or question should include a certain structure. This structure should include at least 4 elements. 4 elements. Description, the patient characteristics, such as additional characteristics such as gender, age, any risk factors, anamnesis of disease, anamnesis of life, and others, and or the additional characteristics of analyzing problem. Analyzing problems such as cough, such as dyspnea, such as fatigue or pain, and others. The next step of this question should specify are we searching information about any intervention, therapeutic, diagnostic, preventive, or we are going to estimate a prognosis of disease or prognosis of any complications. Also, a good request should include clarification or should include information about comparison group of patients. Description of this recommended comparative group for same analysis. And of course, we should understand, and also we should include to this request information. We should find information about outcome, possible outcome after application of any intervention, for example. Which outcomes we are waiting after vaccination, for example, because after COVID and other infections, this is, or which results we are waiting from, or after good immune response after vaccination. So more technical, more detailed information. And now you can see a so-called model of clinical case or doctor and patient relationship in real practice. This model includes first step, patient as object of problem or object of any questions addressed to the doctor, which doctor should analyze for a definite period of time. The person should ask any question or any case. She should should make a model of clinical case for construction of a clinical issue. Issue or clinical request, diagnostic request to the database, to the library for searching of correct and appropriate answer. Next point, third point is application, concrete resources. We should understand clear which appropriate resources we should attract for searching of concrete information. Now let's discuss the situation of this principles application on example. You can see condition of clinical case, patient with acute low back pain. The clinical question here is, what are the effectiveness and safety of drug-free treatment? Drug-free treatment, a non-pharmacological treatment. For answering on this question, we should analyze medical literature from available databases. Main resources which we can find are the results of 2 systematic reviews and 1 randomized control trial, which can show that maintaining physical activity at the same level as compared with limited motor activity leads to a statistically significant difference in terms of rehabilitation, duration of pain, severity too. Second case, which I will demonstrate for you, just middle-aged patient suffers from COPD, and as you can see, he's smoker maybe. But for us, more important clinical question is how effective and safe long-term maintenance therapy with stable COPD. For answer on this question, some investigators can analyze 2 systematic reviews, including 22 placebo-controlled studies, more than 6,000 patients. The results of these studies was shown that the use of mucolytics significantly reduced the average of COPD exacerbation and reduced the period of temporary disability. According to results of these trials, was shown that the use of mucolytics significantly, long-term, of course, long-term mucolytics application provides significantly reduction, average amount of patients, amount of exacerbations of COPD, and reduce the period of temporary disability. In comparison with placebo, was found that mucolytics application decreased the number of exacerbations on 23%. Next very important principle of evidence-based medicine is, or maybe main principle, is critical analysis of received information. So for providing of this analysis, it's also very useful practical skill of so-called smart reading of any medical articles, reports, and even clinical guidelines. So we can characterize these criteria. Firstly, we should clarify a research category which we are reading. Majority of researchers are hypothesize other part, very big part, confirm and can confirm the formulated hypothesis. And next point of this critical analysis of compliance with the study design and tasks of this examination or investigation. We should understand that the weight of each fact is higher than more severe scientific method of investigation was applied. And also we should determine possible extension of the research results to specific clinical situations. After some problems, or for patients with some problems in practice. For example, wrong conclusion, variant of wrong conclusion, maybe same. Hypolipidemic drugs reduced all causes mortality. This wrong conclusion because hypolipidemic drugs can reduce just cardiovascular mortality. So feel the difference between both elements. Of improvement public health. During critical analysis of any material, any data, we should pay our attention to some elements of analysis. For example, whether there is a control group. Next is randomization. It's obligatory procedure which any experienced investigator should organize and should apply. This procedure in different situations when necessary, of course. Next one is calculation of patient. We should define the necessary amount of patients which we should include to our study for getting of recommended by different famous and serious organizations such as some World Health Organization. For example, for organization of epidemiological study of new vaccines or drugs against any serious infectious disease such as COVID, we should collect information from at least some thousands people. Then more amount of these participants, then better, then higher level of so high level of evidence will achieve. And of course, we should also evaluate patients and clinicians were calculated by the blind. And also we should provide the correct, thoroughly and accurately measurement of results or statistical adequate or non-adequate statistical analysis of results of concrete study or concrete article. Let's specify now main levels of evidences according to levels of confidence in the results of any clinical trials, which we can read in different paid papers, articles, and even clinical guidelines. Which factors can influence on confidence? There are high reliability studies and conclusions of these studies, which we can mark as symbol by symbol A. A is first in alphabet, and A is also a maximal level of evidences in specially organized clinical trials. Next one, less reliability, moderate reliability. What does it mean? It means the summation at least one or more quality adequate studies without randomization, without confirmation of detected irregularities. Sea level. This is already moderate reliability or even low. Examination on this level is usually one adequate study. Adequate, it means the presence of experimental and comparative group for checking of possible anomalies of patient and for conclusion about ability to apply these results in usual practice. And last level, minimal level of reliability, so-called lack of scientific certainty. Then the group of experts can prepare agreement or agreed opinion without any clinical guidelines or without serious laboratory and instrumental confirmation. Now the time of break. My request for you, please write to the chat, to this lecture, to the chat, information about the present students in each your groups. You can make it before break, before continuing of our work after break. Now,
So everyone send, or just the leader send the presence of everyone?
leader, of course, leaders.
Okay.
As it was in previous semester. Group leaders, please write to the chat information about your present members of your groups. Now 10 minutes break.